How often do clinicians consider Babesia as a possible cause of an illness after a blood transfusion? I'd like to address this question by looking at a paper that's been published. This is part of a Common Sense Lyme disease series where I discuss these issues. I'm also enclosing a quiz for you after discussing the case. Now, this case was described by Sudhir in 2020, titled Transfusion Transmitted Babesia in a Patient with Sickle Cell Disease Undergoing Chronic Red Blood Cell Exchange. Now, this was a 30-year-old with sickle cell disease requiring multiple red blood cell transfusion, 10 units every 3 to 4 weeks. He presented 2 months after transfusion with fever, neck pain, and photophobia. It went on to fatigue, chills, headaches, and anorexia. The blood smear showed parasites in the red blood cells. The Babesia test was also positive. And in addition, there were 2 other tick-borne illnesses that showed up in the blood test: anaplasmosis and Ehrlichia. The diagnosis was Babesia. The treatment was azithromycin and atovaquone for 10 days. I go longer when someone's been chronically ill with Lyme disease. There was resolution of the symptoms. The authors did not discuss whether they switched to doxycycline in the future for anaplasmosis and Ehrlichia, because neither of these drugs work for that. Neither azithromycin or atovaquone work for anaplasmosis or Ehrlichia. They looked back at the blood that was donated, and there were 65 units over 6 months. 58 were screened for Babesia. Now, not every state screens for Babesia. The most endemic states screen for Babesia, and the rest of them do not. In this case, is one of the 7 that was not tested had Babesia. The person who was donating blood was asymptomatic. Now, the person who donated blood was in Ohio, which is not one of the states where they screen the blood for Babesia, and the donor had been reporting hiking and camping. Now, we do know that blood transfusion can lead to transmission of Babesia. Now, that has been reported. Lyme disease has not really been transmitted through blood supply that we know. Now, that could change over time. The FDA screens are limited to 14 states. Non-endemic areas still pose a risk, in this case, Ohio. Asymptomatic donors, that is, we sometimes talk about donors who have no symptoms to report, they can still transmit infection. I've had patients where the only reason they even know they have Babesia was because they donated blood. Now, the public health implications is that we need to consider expanding donor screening criteria, educate clinicians in non-endemic areas that Babesia might be missed. There's a question of whether to start testing for Babesia in other states, given that the blood moves from state to state, and where the donor is might not be where the recipient is. We need to address policy to reflect changing tick-borne patterns. The take-home message is that even in non-endemic states, a single unit of blood can transmit Babesia. So this is from Costa article in 2020. Now, I'd like to address several issues through a question-answer format. So let's begin. Which of the following is a recognized route of Babesia transmission in the United States? In this case, blood transfusion. Which of the following symptoms would most likely raise suspicion for Babesia infection following a blood transfusion? In this case, fever, chills, and hemolytic anemia, because when the body sees parasites in the red blood cells, you can easily hemolyze it. When someone's had Babesia for a while, then the parasite is out of the red blood cells. You won't see the hemolysis. You don't see the anemia that you would be looking for, but I find that they can be chronically ill and severely ill, and of course some of them are asymptomatic. What is the most definitive way to diagnose active Babesia infection? This blood smear with PCR is the best, maybe blood smear alone is the best way to diagnose Lyme. What is the most definitive way to diagnose active Lyme infection? If you see parasites in the red blood cells, that's a definitive. If you have PCR or antibodies, that shows exposure, and if they're symptomatic and show exposure, I treat, including treatment for Babesia, and not every doctor does. Some of them just assume that it's resolved, that it's asymptomatic. So I reserve that evaluation using clinical judgment if they're ill. Which of the following patients is at highest risk for severe complications from transfusion transmitted Babesia? Adults with sickle cell or immunocompromised or the elderly are more likely to have troubles with Babesia. It's just that a good share of those with Babesia are not elderly and not immunocompromised, so you can't ignore that this illness can occur in a number of patients. This patient just happened to have sickle cell disease. Which of the following donor characteristics should raise concern for possible Babesia transmission? If they reside in non-endemic areas but recently traveled, that'd be important. But if they had blood donated, you're not always going to know that that's been donated from your area or some other area. Which of the following best describes the U.S. blood supply's vulnerability to Babesia? If Babesia poses a continued risk, particularly from asymptomatic donors in non-endemic states, and that's what happened with the sickle cell patients. The A, which is Babesia is no longer a threat, is not true. It's a constant threat. The blood supply is always trying to determine the balance between the cost and the labor of checking blood for Babesia versus the benefit. Which co-infections are commonly seen with Babesia and may complicate diagnosis? In this case, the anaplasmosis ehrlichia were positive in this patients. The other illnesses are not seen and more commonly in Babesia patients, although there's always questions that need more research in this area. What's the first line therapy for mild to moderate Babesia? Oral atovaquone and azithromycin. I have used Mepron, which is 750 milligrams, but I've also used Malarone more lately, which is 250 milligrams / 100, and I even use the pediatric dose, 62.5, if someone has autonomic issues, has trouble with their stomach. Why has universal Babesia screening for all U.S. blood donors not been implemented? Well, this is because screening is based on cost effectiveness in high incidence states. Because it hasn't been eradicated, that would be A. The current diagnostic tests are not FDA approved, or at least at the level you can be comfortable with. And why is Babesia transmission through blood transfusion particularly concerning in asymptomatic donors? This is a question I'm leaving for the comments section, but it's A through D. A is asymptomatic donors test positive on routine bacterial cultures. B, asymptomatic carriers often clear the infection before donation. C, asymptomatic donors are unlikely to be identified without specific screening. Or D, Babesia causes visible discoloration in donated blood. So in the comments section, do what you can to answer the questions, and I'll follow up and read those comments. So thank you for joining me for this Common Sense Lyme series. Have a good day.